Okay, Byron and the rest of you at home, how much candy did you eat this weekend? We all know those milk duds, they are a doozy on your molars. So today, we're going to talk about how to improve your oral hygiene. Joining us now from One Manhattan Dental are Dr. Raimondi and Dr. Sclafani. Good morning, fellas. What's shaking?
Good morning.
Good morning.
How are you?
I'm great with my pearly whites. In full transparency. I have virtually met these individuals, and they know that I do love the dentist. I've never had a cavity, so this is like nothing for me. But you know, for the plebeians, what is the biggest mistake we're making in terms of our oral hygiene?
Well, the biggest mistake we're seeing now, there are a few people that are neglecting their dental visits because of the pandemic and not getting into the dental office.
And that would be my Nigerian muchacha who you met during the break. She said she's afraid to go. What advice do you have for her?
I think it's important that you communicate with your office where you're going to see what they're doing in response, given the new climate of things, how they're handling aerosols, how they're handling the PPE issue, and how they're handling patients coming in the office and out of the office. What's the circumstance like, and what are they doing? We're checking oxygen levels and temperatures. We're spacing every appointment out. We have buffers between appointments. We have air filters in the room. We have point of care devices.
And the key is to develop a routine. Whether you're coming into the dentist or not, you want to have a routine at home, a combination of rinsing, flossing, and brushing.
Well, I love that. Yes. So two things. I just want to back up. Check with your dentist's office, because a lot of you are really going above and beyond when it comes to safety. And there are some dental offices that are doing a Zoom. So that's some good takeaway for folks at home. Something I learned about the morning routine is I brought a little baggie. How pathetic is this? This is my DOP kit. It's a sandwich bag. You say to start with mouth rinse. This is from like a hotel from God only knows when. But talk to us about mouth rinse. Why start there?
So starting with the mouth rinse is going to remove some of the loose layer of plaque that's in your mouth, those little pieces of blueberries that are caught between our teeth prior to flossing. So we want to do a nice rinse first, and then we would lead into flossing after the rinsing.
And does
some are therapeutic.
Yeah, go ahead. Go ahead.
There are some therapeutic rinses too, right? So the one you got at the hotel probably is a mouth freshener without a real therapeutic benefit.
There are some that are. That's exact. It says mouthwash. Refresh.
Yeah, that just refreshes things. There's some alcohol in there, so that can dehydrate your mouth. So we prefer alcohol-free mouth rinses with some type of antibacterial agent, or we like one with some aloe in it that's hydrating.
All right, fine. I will take this and toss it. Before you brush, floss. Yes? I never know.
Yes.
How much floss should I use? Should I try to reach Ben? Should I try? I mean, look, this is my wingspan.
Keep going, keep going, keep going.
If you think it's too much floss, it's too much floss.
All right, fine.
Well, maybe 12 to 18 inches.
That's what she said. So floss, and then make sure you get. Do you want to start on one side of your mouth first? Because I just go wherever I feel stuff wedged.
We've heard that.
Yeah,
We've heard that about you.
So should you start on one side and go to the next side, or just have at it?
I think that's the best, is to start on one side so you don't miss a tooth. Start on the upper left, say, work your way around the arch, and then drop down to the bottom, and then continue with the lower.
Yeah, try a systematic approach,
Okay.
not just going everywhere, anywhere.
Okay, fine.
Randomly.
And then toothbrushes. Should we be using, this is like the manual, but you guys are also fans of the mechanical toothbrush. Yeah, the electric toothbrush. And you told me go on an angle towards your gums for how many seconds each?
Okay, so we prefer an electric toothbrush. We like them because they have timers in them, so you're brushing for 2 minutes or so, or more. And they also have sensitive pressure indicators in them, so you'll know if you're brushing too hard. One mistake people make is they brush too hard. And then also you should angle, like that picture is showing,
At a 45 degree
towards your gums.
All right, fellas, I have questions in the studio. This caller is originally from New Jersey. His name is Dan Manarino.
Yeah.
Go ahead.
Hi, guys. Thank you. First-time listener. Long-time listener.
You always get it wrong.
Always get it wrong. Always get it wrong. I have a
First-time
question
flosser.
about those little tiny, like, toothpick things with the floss on them. You know, they're called something, right?
Oh, yeah.
Yeah, I know what you're talking about. They're like little slingshots.
They're like, and they have that little piece of floss. Do you use just do you use just
like a tuning
one?
fork.
Yeah, it's do you use just one for your whole mouth? Like, what do you do?
Floss.
You could use one until it starts fraying right before it tears, and you can get rid of it. They're not as effective as using the floss that you can really wrap around
yeah.
the tooth properly.
I like the gum
But it
picks.
is better than not flossing at all. I
see.
find that works better with children that don't have the dexterity to floss.
Which is
I'm
perfect
a,
for Dan.
I'm a child. Yes.
Rainbow toothpaste.
That was it. Yes,
Now
I
it all
also
makes
used the
sense.
bubblegum toothpaste.
bubblegum toothpaste,
Yes.
yes. The best.
Called him a
He's still
child.
using non-fluoride
Yeah.
toothpaste, by the way.
This explains so much, guys, because I have 8 cavities.
Toy Story.
There we go.
Oh my goodness. We have sadly run out of time, but thank you so much, Dr. Raimondi and Dr. Sclafani.
They were great. Come back.
Yeah.
Can't
Thank
wait
you.
to do
We would
this
love
again.
to be back.
Thank
Come
you,
visit
guys.
us.
Consider it done.